setting up. Okay. And we're off in 3, 2, 1. And we're live. All right. What's going on, guys? Thank you for checking into the Checked In podcast. Truly appreciate you guys stopping by. I know majority of you guys are either driving, at work, or some of you might be actually bored. But for the most part, I want to introduce myself. My name is Eric, and I'm here with my co-host.
Hey, it's Dominic, guys. How you doing? Going strong. Hopefully everybody's had a great week. Again, it's coming out Friday, so hopefully you guys are enjoying us getting into your weekend. And today we have a very special guest by the name of Monica. How you doing today?
Hi, I'm doing really well. Thank you guys for having me.
Cool. So how's everything going? Just get straight into this. How's life? How's everything?
Well, life is great. I feel like I haven't seen you in like forever.
Yeah, it's been a while.
I did ask him if you went to the reunion, and he said yes, but I do not remember seeing you.
I was sitting in the back, honestly. I won't say I helped out a lot, but I just helped out a little bit. David Sines was set up a pretty good little spot there. So, but I just sat in the back, drank some beers. It got exciting towards the end of the night. So,
So I heard.
Yeah, at that time it was like, yeah, it's time to go home. It was already like maybe 2 or 3, and it was just time to go. So, but yeah, I mean, wow, it has really been many years, huh?
A lot.
Wow,
Many years.
I feel old now.
We are old. We're getting there.
And I just want to go ahead and let everyone know, that she brought her pup with her, and her name is Molly, and she is a pit bull. Am I mistaken, or is that right?
No, you're right.
All right, cool. I just want to make sure because there's a lot of mixes nowadays.
No, she is a pit bull.
She's adorable, by the way.
Yeah.
She's a
6
cutie.
months.
She just got off of her surgery.
Yeah, she got neutered because my
Oh.
dad's out here trying to make business with her.
She does not like Dom. She just growled at Dom right now. She's like, get
She's
away.
just protective. She's just her own person. She really is. She'll let you know, like, don't fuck with me. Or she's like, all right, cool. Like, but she'll ease into you. Believe me, she will, because she's getting near you, so she's good.
That's good.
If not, she would just like not have it.
The good thing is that she's actually chilling right now.
Yeah,
she's
she's
not going
very
crazy.
chill. She's like this all the time.
Cool. And we have a bed for her, so we're gonna. If you guys hear us making a lot of noise, it's because I'm moving the bed around. So that right there, so she can chill. But for the most part, it looks like she's having fun.
Yeah,
Look
she's
at her.
chilling.
She's chilling. She's exploring.
exploring.
That's cool. Also too. Okay, so just to get into it, if you can, you said that you deal with plastic surgeries, correct? What is
Yes.
the official title that you are?
I'm a surgical tech.
Surgical tech.
Yes.
Now, what exactly does a surgical tech do? I know it sounds like it's straightforward and in the name,
Yeah.
but I'm sure there is a couple little things here and there. So what exactly is it?
So it just depends the type of setting that you're in. In my setting, because it is a plastic surgery place, pretty much my job is to have everything in line before the doctor gets in. So I'm in there before the doctor's in there, in the OR, setting everything up, table, mail stand, everything, instruments, gowns, gloves, everything that they're going to use for their surgeries.
Now, what
then
kind
after-
of surgeries are we
So
discussing?
we do breast augmentations, tummy tucks, liposuctions, fat transfers,
Can I get a fat transfer?
Yes, you
Transfer this
can.
fat out of here, please.
Let's do it.
Thank
Let's
you.
put it in your butt.
I don't need a BBL. I just don't need fat anymore.
Oh, then we could do lipo then. We could do lipo. You can put it somewhere else. You can put it on your cheeks, anywhere, You'll
Let's
be
stay away from his head because it's already big as it is.
surprised. We can definitely put it elsewhere. Trust me, nowadays, wherever you think of putting something, I'm pretty sure you can put something anywhere.
My pinky toe is a little small. I might want to make that
We
one
can
a little bit
definitely
evened out, yeah.
get that a little thicker.
So with that broad spectrum of surgeries, what would you say is like the most common one?
The most common is probably going to be a breast lift, where patients sometimes they have kids, and then their boobs don't look like they did at one point in their life, or they probably just never had good perfect boobs, and then they do the breast lift and they get it done, and honestly, it is a life changer. Okay. It really, really is.
Now, I have to ask you, is there any customer? I want to call them customers. I know you call them patients. I understand. Yeah.
Or clients.
So, yeah, or clients. So if you hear me say customers, sorry. But have you ever had any patients or any clients came in with that and were like very nervous, very scared? And then like, have you had any like horror stories like that of how patients have came in, how they've either gone somewhere else or things like that, and you guys have helped them? Do you have any?
Yes.
If you feel comfortable discussing
Yes.
it, yeah.
No, yeah, of course. Everyone is different, and then obviously a lot of people don't, sometimes they don't do their research. Honestly, we're just lazy, just in general, I would say. But it just has to come down to doing your research. But we have had some scary stuff where one is super super hard and the other one's just looking normal, and one's higher than the other one when it comes to the breast, and they think that's the way it's supposed to be, but it's like, no, it's not. Like, you should look at your body, think of if anything's abnormal than what it's supposed to be. Liposuctions, I would say it's the biggest ones too, because not everyone as doctors can do liposuction, or they haven't had enough years of practice. So, some patients are indented or their scars are really bad, but I would say more like the indentation of your skin, it would probably be the worst, because that's something, in the summer they want to go, they do this because they want to go out and be in a bikini for whatever reason, or, be with their families, or, their significant others. But then that's where like the self-conscience comes in, because they're like, I don't feel good about myself or anything like that, but that's pretty much it. But it's scary. Molly.
Hi, Molly.
Sorry,
You're okay,
she's just
Molly?
being overprotective.
No, she's okay.
She hears something.
She hears something, so she's gonna go ahead and let us know. She just hears that noise in the background. It's okay. She's chilling.
Just being overprotective.
I know. She's like, I'm ready.
Yeah, she's always ready.
So you would say like for those customers that do come in, for the customers that you say about these stories, are those the customers that are already coming in and they've already had certain surgeries, or is it just certain things that it's going on with them that they're not aware of?
It's that they've already had surgeries, so they're
Okay.
just kind of coming in to like revise, because because you had asked about like if they went somewhere else and they got like a botched job. I guess you can kind of say that's what a lot of people are more familiarized with that word. So then that's when they come in, and thankfully with the doctors that I have worked with, they've actually been able to fix it. And it's a lot of years of practice that it comes into seeing how they work. It does take lots of years of practice, and then they say it themselves that if they have never said that something like that has happened to them, then they're either lying or they haven't done enough, because it does happen, and there's always possibilities of something going wrong, but then that's where they sign their stuff indicating that it's a possibility of it happening.
That's where waivers and stuff like that.
Yes, the consents, exactly.
Now now you're describing pretty much like a customer that came in and had that previous botched story. Now, have you ever had customers that came in just scared in general, like their first time just going through it? Do you have any like customers that wanted to back out last minute?
Yes.
Yeah, like
Or that they have.
Oh.
Yeah, they do. And a lot of the things is like, they're already scared. So when they come in, as my job to as well, being there, it's to make them feel comfortable, like it's okay. The fact that you're nervous is, first of all, nervous is good. It just means, they're human. Obviously, it's not like you're going into a store and buying some candy. Like you're really, or like buying a car, you're nervous, but you're going to make that monthly payment. Like these people are paying cash, like they're paying cash money. So it's not like or even if they do financing, like even then, like they still have to pay that back, so it's not like they're just making a small purchase. So of course they're always nervous, but you just kind of have to reassure them what we do. It's every day we see people like this. It's every day, it's gonna be a constant thing. But I feel just having that connection with them just really, really works very well, and they feel more comfortable. Then they speak to the doctor. At the end of the day, it's just reassurance. Like, look, we've done this. The plastic surgeon, obviously they have their license. They're board certified. Like, this is what we do. They've been doing this for so long, so it just makes them feel a little bit more comfortable.
Yeah, 'cause you got to remember, they're getting their bodies augmented, and it's like it's not a small little thing where. No. Oh, I'm just gonna go in, nip and tuck, but it's more than just that.
No, and they're under general anesthesia too.
Ooh,
so
wow.
they're asleep.
Nice.
They're asleep.
Now, my other question to you is, how did you get involved in this? Because we went to school together and things like that, and obviously after high school we all go our different ways. Did you go to college for this, or is this something that you kind of like fell into?
I fell into it. Well, I mean, I always knew I wanted to be in the medical field, but I just didn't know what. In a sense, I was a medical assistant for a while, and then I did go to school. I just got like my general, like you can say MA, because I got my patient care technician, which is like a combination of that as well. And then I fell into working with Doc. Everybody knows Doc. I'm pretty sure the doctor that I've been working with 7 years, worked with him for a long time. So I fell into his practice, and the reason why I fell into it was because my resume was on Indeed. So it was open to like,
okay.
the medical facilities or anything medical.
Right.
And so he ended up, his manager at the time called me and was like, oh, we saw your resume, like we want you to come in for an interview and this and that. And I was like, okay, cool. I thought it was just a regular medical office, like the normal general, you get sick, you come in, bring your kids type thing,
regular RN nurse.
Yeah. So then when I went in and they explained to me like, oh, he's a cosmetic surgeon, so we do this and this, we do Botox and fillers, and these are our clinical days, and then these are surgery days, and it's kind of like a rotation and stuff like that. So what do you want to be a part of it? So then she brought the doctor in, I met with him, and I was like, all right, cool. So then I went for a practice run the second day, and then I liked it. That was their surgery day. That's why they're like, anybody could do office work. He's like, I want to know if you have the ability or the capability to be in the operating room, seeing everything, and running around doing this, thinking quick and all of that stuff. So I was like, okay. And I mean, I think 21 at the time, so I was still young and barely starting life. And yeah, I came across, and that's how it all started, and I ended up liking it. Now I didn't go into the surgical tech right away.
I was just about to ask you that. Yeah, okay.
It took steps. I didn't go into it right away, but what had happened was that I did that. I worked for an office and his back. So in the back, I was just helping with like the basic stuff, checking in the patients with the surgeries, not doing anything surgical because he had his staff for that. I was just doing the minimum. And then eventually, like, I just started learning everything, everything that had to do about cosmetic surgery, fillers, but everything that had to do with the practice. Like, he saw, and then he pretty much was like, well, I want to teach you, I want to take you under my wing. I want to teach you how to do this, how to do that, be more a little bit in debt, like train you the way I want you to do stuff around here. And so that's kind of what happened. And then I think probably within like a year or two was when his surgical side kind of left him, I guess you can say. They just went somewhere else, and he was left with like, what the hell? Like, what do I have to do? Like, I have nobody now. But I already was familiarized with everything breast dog, everything, but just not the surgical side. So then at that point, he asked me like, well, do you want to learn this? And I was like, learn what? And he's like, well, learning how to be in surgery. Like, I can show you how to do this. You're going to be working here with me so you can do it. Like, I just need you to help me, pass me some instruments. Like, it's not rocket science, know? And I didn't know any names I knew some of the names because I used to help them with just putting the stuff away and stuff like that. So I needed to be familiarized because I needed to know where the things go,
Right.
So then from there, like, that happened, and I learned quick. I just learned quick. He took me into surgery, and I'm like, I'm down. Like, I mean, I'm a go-getter, so I never get nervous. I'm just like, yeah, I'll do it, And so that's pretty much what happened. And then, yeah.
So as time went on, as time went on, you ended up getting your certificates and everything like that.
Yeah, I did everything backwards actually. So learned. I did, which was good, because the experience is what actually gets you in the door, and it sucks because sometimes people are looking for places. People are looking for people that have experience.
Correct.
But then it's like, how do you get the experience if you don't allow me to get the experience or work for you to get the experience? So.
Right. That's like for just about any job. Any job. You guys get these guys that are out here doing 10 years in college or whatever it may be, but you got this guy walking in on the street, and it's like, all right, cool, I know what I'm doing. I don't have certificates. All right, it's a great example where it's like you have her coming in and hey man, I'm just here for the job, and I happen to excel at it.
Yeah, that's what happened actually. Like, I got promoted very quickly. Then I ended up, becoming his office manager, and I didn't want it because I was scared of it. He's like, you're gonna take it, and I was like, I don't want to take it. He's like, yes you are. I'm like, no, I'm not. And he was just like, yes,
I could just imagine how that back and forth went.
Yeah, because we became really close, so it was just like, I don't want it, like, I'm sorry that these girls, they just left from one day to another without giving you a heads up, like, not the right way. But he had someone else that had been there a year longer than me, and he didn't offer her the job. But then he's like, I had told him like, well, give it to her, and he's like, I don't want to give it to her. Like, I want to give it to you. Like, you're the one that's going to take it. So eventually, obviously I said yes, I took the position. And then not just that, I was being office manager as well as his surgical coordinator. So then pretty much within like a 2-year span, like, I just started like taking over the whole practice, and I just did everything for him. I ran his office, the operating room, all the surgical stuff, everything. Like, my life just did a whole like 360, and
a whole new workload.
Like, from just being like, okay, I'm open, and cool, bye, I'm leaving at 6. Like, now I'm there at 9, and I'm there till like 8, 9, and And I learned everything that had to do with surgery, at like just everything that had to do with just the whole practice. I learned it from like top to bottom, and that was pretty much it. And then COVID came, and my sister had already told me, like, if you don't go to school for this, like, something can happen, and like you know, you're not gonna be with him forever. Like, you probably feel that, but you know, you have to. So she's the one that actually put me in school. My older sister.
There
Yeah,
you go.
she's like, you're gonna do this, and she did it too. So I guess that's why she brought me along. But it was a perfect scenario because I know that I couldn't miss work because I was the one that did everything, so I didn't have time for school. So during COVID, we worked the entire year. I had no days off. I was there till midnight sometimes, you know, no days off or anything like that. And then, so that gave me the opportunity to go to school because it was all online. So it was like a blessing in disguise. So then I finished school.
Wow.
So I got, you know, I got the certificate and everything. So now I'm legit.
That's good.
Well, see, that's drive and determination, which a lot of people don't.
Yeah.
Yeah, there's a lot of people that lack that. And the cool thing too is that the way that this reminds me of, it kind of reminds me of like a trade. So like, you know, most trades, you have to go there, you start at the bottom, you put in your time, and then you work your way up.
Yeah.
And I feel like a lot of jobs should be like that. Obviously in the medical field, it is a little different, I
Yeah.
guess, because you have a lot of like, you know, depending on what you want to get into. I feel like if someone is going to go to college, at least medical, lawyer type things like that, like those are very important. And the cool thing is that although you started backwards, it did help you, like you said, in the long run because of that. So
Yeah.
when you did school, it was so much easier. Like,
yes,
oh, I know
because
this.
I'm like, I know what this is. I know what this is.
Yeah.
And my sister's like, what's that? I'm like, girl,
Yeah,
I'll
like-
tell you the answers.
And that's
Yeah,
the cool thing. Yeah, because a lot of people don't do that.
Yeah, no. So that's why I was very thankful because it was just super easy, like going, and it was just a flow. So it was good.
Now, I'm going to ask you about a very popular procedure, which is the
Yes.
BBL.
Yes.
I'm going to ask you about that. Now, I want to ask you a couple things, and you can answer it however you like.
Yeah, of course.
Most people, when they go in there, and I'm sure you guys have to ask them, like, why do you want to do this? Is there a question like that?
Not why. No, actually, no.
You just kind of look at them and be like, all right, cool,
they
we can
just
do
like,
this.
you know, we just ask them like, hey, like, what do you want to do? You know, like, what are you interested in doing? And, oh, I want this. Like, okay. And, you know, it's mostly because girls lack of like the hips, like the dip hips on the butt. Like you can have a big butt, but if sometimes just those hips, like just won't, like they just won't come out. You know,
It starts looking a little unnatural because you see some of these girls who are, you know, sticks, and then they turn around and they got a basketball on their back. And it's like,
Things like that, yeah.
what's going on
yes,
here?
that was
Now-
back in the day with the implants. That
Yeah.
was before the fat transfers.
So now my question to you on that is, now that I asked you, like, you know, do you guys ask why?
Yeah.
But when they go in there, what is the process like? Pretend right now, like the
I'm coming
yeah.
in to get a BBL right now.
yeah. So
All
what would the
right.
process be like? Like I come in, hey, I want to get a BBL.
Yeah.
What is the process?
So
like?
first and foremost, you have to be a candidate. So you have to have enough fat. You know, sometimes it sucks because, like you said, the girls that are like super skinny and then they have something so big is because maybe they're just not a candidate because they have no fat.
Oh, okay.
You know, so their only chance is either doing some fillers in their butt or putting in an implant, you know. But for the most part, you know, it's really big in the Hispanic world.
The BBLs?
Yes.
Okay,
The
I-
BBLs.
alright.
Very
I would have
big.
never noticed.
Yes, very
Nah,
big.
would have never seen that weather girl go crazy.
Hey,
But
that's
you-
natural, bro.
But they get excited because, you know, they have the fat, you know, so they have enough fat, or even if it's something and then they're actually able to, so they take that fat out and then they transfer it to their butts. And that's pretty much it.
That's
That's
like a syringe, turkey-based here.
so everyone is different. Back in the day, they used to use the syringes where it's just individual, like they can have like 10 syringes full of like fat, and then but now like they just have like a whole machine setup where it's like, as the doctor's taking out the fat, you know, it's like suctioning it. So like the best way is like a straw, you know, like it's going through a straw and it's going into a canister, and then that canister cleans the fat, and then only the fat goes into the butt. So there's like different tubes. So one tube goes with the fat that's going out into the canister, and then there's another tube from the canister into the butt.
Wow.
And how long does a procedure like this usually take?
About like 2 hours and a half.
Really?
bad.
Yeah, it's not so
Wow.
bad.
I figured longer, but
No, it's not so bad.
Wow.
No, it's
I mean,
not
I guess
bad.
that beats going to the gym every day at 6 in the morning. 5
Yeah,
in the
no,
morning,
and then your
doing
butt
it.
Once you do
grows.
hard work.
And your butt grows.
Oh, you know what? I actually have a question for you on that. Okay. My question to you is this. So now, it's funny that you bring that up because I was going to ask that a little bit down, but I guess we were going to jump right into it. I have seen I have seen that there are girls that they get it done, right?
Yeah.
And then they decide, hey, you know what, I want to be a fitness person now. Okay, whatever, right?
Gross.
Right. So they get into that field and then they really take the fitness journey really serious, and then they're getting bigger and everything like that.
Yeah.
And I have noticed that sometimes it does look a little odd because now they're growing their muscle.
Yeah, so
and-
that the butt and everything, like all the cells and everything is growing with the butt.
Yeah,
So, yeah,
exactly.
especially if they have their good nutrition and everything. Like, yeah.
I've seen that.
Your
I
butt's
watched the
gonna
video
grow too.
yesterday. Yeah. I watched the video
Yes.
yesterday on Instagram, and I seen that, and they asked the girl, like, "Are you natural?" And she goes, "Oh no, look." And then I noticed the butt was a little bit more out than most, but she was very fit.
Mm-hmm. Yeah.
So I was gonna ask you, since you were gonna come on, I was like, "Wow, is that something that can happen?"
Yeah,
that you
it
just come
does
from
because
the-
remember, it's like
Still living
anything
tissue,
else.
right?
Yeah, it's like anything else. Like if you eat, you know, you don't exercise or
expand,
anything,
you
you expand. Exactly. So same with the butt, but now it's like your butt's expanding. Obviously it doesn't get too crazy or anything like that, but it does grow. Those fat cells do multiply. So once they adapt and they do start multiplying. That's funny that you asked that because I did have one patient one time where she did one round. And then she's like, she loved it so much. And then she's just like, I want to do another one. And then
okay.
we're
Like, what do you mean?
like,
How do you do another one? What do you mean?
like she
Transfer
just,
more fat?
yeah, she
So
just,
she wanted to get bigger.
she wanted to get
Wow.
bigger. So then, and she was thick, so she wasn't gonna be one of those girls where she, like you said, Dom, like they look weird because they have like skinny legs. She was already thick as it
That
is.
Bugs Life moment.
Yes,
Yeah.
yeah. So she was good, So, but we had told her like another one. Like, are you sure? Like your butt looks good right now. Like,
So is that where you ask the question, why? Why do you want to do this?
right there. Then we say like, why? If it already, but
Yeah.
vanity, us girls,
that.
we love us, hate us.
You never have too much makeup on.
Exactly, but her butt grew. She came in 6 months later. And she's like, dude, my ass is bigger. I'm like, I told you. I'm like, she's like, I just didn't believe it. I'm like, well, now you see. She's
not
like,
medical
my butt.
professionals for
Yeah,
nothing.
exactly. We're like, no, I told you your butt's gonna get bigger, and it did. And she just didn't do it. She was just content. She's like, I'm good like
That's
this.
crazy,
Yeah, I was
though.
like, just keep exercising and keep your butt. Do exercises, do squats, anything that has to do anything for your butt. That's gonna help you out, and you'll maintain it.
Now, okay, so we did talk about the breast lifts a little bit,
Mm-hmm.
and we did talk about the BBLs. Is there anything else? Obviously, you said you guys do lipo and stuff like
Mm-hmm.
that. What's the process like for lipo? Is it kind of similar to the BBL, or
Yes, except that fat is just being thrown away.
It's just
and
thrown away.
you're also contouring your body. So a lot of people don't know the difference, but a BBL has nothing to do with liposuction to your body.
Oh,
A
okay.
BBL,
I didn't know that.
Yeah,
It's
so
just the
BBL is a
transfer of
fat,
fat, yeah.
exactly. BBL is a fat harvest, which is harvesting that fat for your butt. It's not contouring your abdomen or anything like that. But liposuction, that's to contour your body. So that's why that fat just gets thrown away. But people, sometimes they do 2-in-1 because they're like, well, why am I going to waste it when I can just transfer it? So, they just do it
I have a
together.
dumb question.
No question's a dumb question.
Would like lipo and gastro go hand in hand, or
Gastric sleeve?
gastric
Or-
bypass or anything like that? Or is that
No, that's different. That's for
Okay.
someone that's like more like on the obese side.
okay?
So they do that and they literally like just staple your stomach, take that piece out. I've seen one.
I've seen many. So I have
Yeah, you
long,
take it out.
long
But
nights.
then there they go for that. They just lose the weight. So then at that point they have looseness of the skin. So then when it comes to that, then you would probably want to do like a tummy tuck on your stomach because you're gonna get rid of that excess skin.
And now is that something that you guys also provide?
Yes,
with
tummy
that?
tucks.
Okay.
Yes, yeah.
And
so.
I've heard of people getting multiple tummy tucks.
Yes.
Is that bad for you?
It's not that it's bad because if you're healthy, then you can undergo. But it's like, why do you want to go through that? Like tummy tuck is like you're bent over for like 10 days. You have drains in your like coming out of your stomach.
It's called
because-
colostomy bags or something like that.
They're called what?
like colostomy bags.
No. It's literally like you're just bent over because your skin. Remember, okay, so pretty much in a
Well,
way,
eat, drink,
the tummy tuck, like you pretty much cut the skin from a little bit above the belly button down. So all of that comes out. So pretty much your bottom abdomen is the one that's getting ripped off. And the skin that you have on the top is the one that's getting pulled down and stretched out so you can connect it.
So okay? So now that is kind of something that I want to ask you. Like, how when a lot of girls do the BBLs,
Mm-hmm.
when you look at their stomach, that's kind of like a big giveaway because everyone with the way they pull it down is kind of similar. Would that be
Mm-hmm.
something that that like you're describing? Because I don't know if you've seen most girls that when they do. Well, I'm sure you have. Obviously, you're the one that doesn't. But
I see a lot of naked bodies.
yeah. So like, is when you do that, is there a specific pool that you guys do? Because when I look at, for example, like celebrities like Kim Kardashian or like all these other girls, when I look at their stomach area, I notice that they have like a same style of
Yes.
pool.
Yeah,
and things
because
like that.
it's not the pool, it's the way the inside of the sutures are
Okay.
done. So they always go from the top all the way, pretty much your whole stomach, from the top to bottom, you know, and that's all sewed. And then they also do the sides, like on the sides of your like flanks, like your love handles, I guess you can say, in a better term, so everybody could understand.
Okay.
So then when you do that, that pulls and it gives you that curve. So when you pull the skin down, it's always gonna have that look. Yeah.
Okay, so that makes sense. Okay.
Yeah.
Now another question that I wanted to ask you is, do you guys do anything to the face as well, like as far as for like lip fillers and things like that, or is it just like
Yeah. No,
like,
yeah, definitely lip filler. Anything lip fillers, you know, on your cheeks, on your nose, on your chin. But we also do facelifts and stuff like that. So
What's a facelift?
a facelift is when you're gonna stretch your face out. Literally. So it's like older people, that's more for like an older person if they have like droopiness of their cheeks or like their jaw lines or anything around their mouth, and just fillers are not gonna cut it because you can't really fill in once that density of the skin is low. So then, you know, you open it up and you pull the skin and cut it out. So it's normally around it's behind your ear that gets cut, and then like on the side of the face a little bit, you know, you pull that skin. It's actually it takes forever. So, you know, you're in there for a long time. It's
like,
annoying.
what is an average time
Maybe
for that?
sometimes like 6 hours, 8 hours. Yeah, it just depends if
Cuts
they're
have to be
doing.
precise or-
Yeah, not just that, but also the inside of the muscles. Like you can't mess with like certain nerves, because then if you mess that up, then your skin, you know, it's not gonna have any movement or any function. So that's why it takes a long time. But also the sewing, you know, just suturing. Imagine like super tiny behind the ears. They also staple too, just to make it easier. But honestly, it's not a drastic change with all of our patients. They still look very like themselves. It's not like they look all stretched out. So it's a good part. So yeah.
Wow. So what would be a procedure that you would say is the longest and the most time consuming, or the most time? Because I know some of them are not a very long procedure, but some of them are very time consuming and they're still short. So what would you say is the one that you look at and you go in there, you're like, man, I'm dreading this one because these always take this or whatever?
I would say like a breast lift or a breast reduction.
Really?
Yes.
Okay, what would you say the comparison is between the breast lift and the breast reduction? Like how, on a number scale, who comes in for what more?
Normally probably breast lifts.
Okay.
Yeah, because reduction is more like when a patient is like a H or like a G size, you know, and they have so much, so they need to reduce it to make it smaller. And then a lift is normally, like I had mentioned, like the people that come in, they have kids, and you know they're just low. Yeah, you can use a lift. They're just low, you know, and like, or they just have semi big boobs and they just want them to look perky. So for sure the lifts are.
Wow.
They come in for more, the lifts.
Now, have you guys ever done any male patients?
Yes.
Now,
we are a big transgender community
Wow.
people. Yeah. So that one was with Dr. Marafati. Yeah.
So what would they
the male.
normally come in
The
for?
breast. Yeah.
To
Breast augmentations. Yeah.
to add. Okay.
And you know, because they're, you know, depending if they're taking like hormones or anything like that, then they have some type of breast tissue. But since they start with nothing because they're flat, their boobs actually end up coming out way better because they just
Wow.
are nice and round with the shape. So they end up coming out with better shapes.
That's interesting.
Yeah.
Dom might actually fall for one.
Mm-hmm.
Pass. No, they're gonna think I'm transphobic.
No. The thing too is like, do you do any like BBLs on them as well?
Yeah.
Yeah.
Yeah. They do the BBLs
Like,
as
what's
well.
the process
Anything,
like? Is it the same? Is
anything
the same process?
Let's
like
just
that?
make it easy. Anything a girl does, a male can do too.
Really?
Yes.
Anatomy is the same no matter what.
Yes.
right?
The only thing is that one's a vagina, one's a penis.
Right,
You got
right.
other than that, everything's the same. You got the same muscles. You got the same everything. Everything.
Do you guys do? Because I've seen this recently, where I don't know if it's is it the Liver King? I'm not 100% sure if you've ever heard of him.
Oh yes.
You've heard of him? Okay, the Liver King is
really jacked dude.
really jacked, short
Coined.
dude. He's just super big, right? And he recently said that his abs were implants. Do you guys do something
Like
like
pecs.
the
Yeah.
pecs and the abs
Yeah.
and everything? Yeah. Do you guys do
Not
something like that?
not the ab ones, but we have done the pecs
Really?
for men. Yeah.
What is the process like for
but
that?
normally it's like you going through the underarm, and it goes swoop, because there's a natural connection from your underarm to your breast.
So what do you do for that though? Like, what do you
What do you
add
mean?
fat in there or?
No, it's a pec like an implant, but it's
Oh, it's a
shaped-
pec
yeah,
implant.
it's a
Oh,
pec
wow.
implant,
Oh,
but it's
wow.
shaped like a pec. And normally, the
Like,
guys
who qualifies
that do
for
that,
that? Yeah, who qualifies
normally,
for
well, I mean, anybody can qualify if they're like you said, like girls, like it's vanity, you just want to get it
Yeah.
done. But I don't know the medical term of it. But have you ever seen guys when they have like a sunken in chest?
that? Yes.
exactly what
You know what I'm talking about?
Yeah.
They would be great qualifiers because that's just their natural, like, that's just natural.
Right.
So then you put in a pec and then it gives them that form.
Oh, look at her. She's all excited.
I'm sorry.
Now she's playing with Dom.
Now she's playing with Dom.
She barks at me now. She wants to play with me.
No, she wants to play with you. Guys would be, yeah, but if you know what that means, then those guys would be the ones that are the qualifiers.
Yeah, that.
I,
So
I apologize, guys. I just have a dog playing with me, so
that's hilarious. No, it's funny because I would say I would qualify for that because I have a little tiny bit of it that is a little sunken. So that's actually pretty funny that you said that. That's very cool.
Yeah, you can definitely come in whenever you like.
Yeah, because I was normally more of the skinnier kid, so that's
Aw.
actually pretty funny. I know. I didn't have a lot of meat growing up.
You
so,
poor
know.
thing.
now you're fat.
Yeah, now I'm fat. So hey, but you know what though? A lot of the people that went to high school with that were like thick, like how I am now, they're just fat.
Yeah.
They're just butterballs, bro. I be looking at, it, I be like,
Or they got fat. Oh,
oh,
Lord
dude, they
Jesus.
just let themselves hella go.
Yeah.
But it's hey, you know it happens. It's part of life. Some people get caught up with work and things like that. But I mean, hey, at least we have Monica here that you can go to, bro.
Yeah,
You guys
can
come
go to that. Yeah,
me.
you guys go see
I will
Monica.
help you. I'll be your savior.
Now, at the facility that you were at, how long were you there for? Because I know you recently said that you went somewhere else.
Yes.
Okay.
I just recently switched. I have my new job since December of
And
2022.
how was that transition
It
like?
was so sad.
Was it really?
Yeah. I was with Doc for 2016 till now. So like 7 years. It was going to be 7 years. Yeah.
Wow.
It was going to be 7 years.
That has to be a big difference.
Yeah, it is a big change, but it's like sometimes as a person when you want to grow and there's room to grow, and that's where like the tough decisions in life come, because sometimes you get so like comfortable. It's like being in your job is like being in a relationship. It should be, it's committed and it has to be both ways, not just one way. And
Give and take and everything.
yeah, and then you just want to be valued as a person and stuff like that. So I guess everything that I wanted, I wasn't really getting. So then that's where I just kind of had to make the change. And I mean, I was a workaholic. Everything was on me. It got to the point where everything was just on me, that if something wrong would happen, like it was Monica's fault. Like, it's Monica's fault. Like, excuse me. Like, no, it's not Monica's fault. There's a captain of the ship, and if that ship's going down, it's the captain's fault. I'm not the captain, but
I mean, it's always easier to put the blame on someone else, though. Let's be honest. Yeah.
It is, which I already knew that. But, you want to be, I was always so happy going to work, like, oh, I'm working out. Like, I'm going to do this. Like, I have this. I had everything on my shoulders. Like, that man did not have a worry. He didn't have to worry about anything. Like, not even bills. I paid all his bills. I paid everything. So everything was really good. But then when it's like I mentioned, it's a relationship. So when you're not getting back what you're giving, you're kind of like, hey, what's going on? And then when you bring it up to their attention, like, hey, like, well, I want this, I want that, like, and it's not happening, like, you kind of have to think, think for yourself. Like, obviously, yeah, I have to look out for myself. Like, he's not going to look after me, he only did so much, other than that, then no.
Right on.
So then I had to make the tough decision, and I left.
Now,
I left.
Are you at the same position, or is there?
yeah, what's it like
Okay,
now?
so
what do you
now it's like I hit the glory.
Oh, here we go. Here we
From
go.
doing everything and having so much responsibility and so much weight on my, I just kind of felt like, oh, I'm too young to be dealing with all this. Like, I shouldn't have these stresses, of like doing all of this stuff. Even though I knew how to do it and I handled it well, it wasn't hard for me. But, at the end of the day, like, I needed help, So like now, and I took a 3-week time off, which I had never done ever in my life, because I was always working. My vacations were 2 days off, which was probably like leave on a Thursday, miss work Friday, have the weekend, and then come back Tuesday. I would miss Monday too. But that's it, just 2 days. and that's not fair,
Yeah,
because
yeah.
when the doctor's over here taking a whole week off for 15 days, but then Monica can't take nothing off, it sucks. I did pump work first. I put my family to the side and was like, I need to do this and I do that. And it's not cool. It's not cool when you start missing things or the kids are telling you like, oh, you're missing, my nieces and nephews. So now being at this job, which is so funny because it's literally around the corner from my old job.
Wow.
So it's
Rub
not
it in their
even
face
that
more.
far. Yeah, it's not even that far. But from Costa Mesa, I went to Newport. So not even that far.
There you go.
But I'm just a regular like front office. Like, I'm still, with the patients and everything, but I'm not doing anything at all. I'm getting paid more and I'm working less. I still do surgeries. I didn't think I was going to do surgeries because I wasn't trying to do surgeries because I just felt like I did it so much that I was like, I'm cool. I already got the experience. I'm good. I did it for like 5-6 years. I'm good. And it was every day, like every other day. So I was very comfortable. And, so now I do help the OR because she does have her own operating room as well. So now I'm working with a female doctor. Yeah.
What was that like? Because I know you went from a male doctor to a female doctor. What is the difference on that?
Well, there's no difference because they're the same cultural. They're the
Oh,
same
okay.
race.
Yeah.
So it's still like dealing with it.
Right on.
But it's just with the girl. But the thing is that I already know how to handle it. So it just makes me laugh. And
Right.
I just kill her with kindness. That's all I can do. Like, yes, doctor, yes, this. And I feel that since I just answer like that, and I don't let it bug me, so I feel maybe she probably gets a little bit more mad because she's just like, damn it, like it's
Right,
not
right,
bugging
right.
her, but they're doctors, that's why they're doctors, and but I do help in the operating room from time to time and as their surgical tech as well. So because she actually has other doctors that go in to use her surgery center, so sometimes when she has surgeries and then other doctors there, so then they need me to help because then I'm an extra hand. So she kind of got the jackpot with me because I'm 2-in-1.
Right.
Because I'm doing both, but it's not the same pressure. I'm only doing what I'm supposed to do. I'm not doing anything extra. I don't need to worry about anything, any payments, any this, any that. So it's easy money.
Yeah.
I go in at like 7:30 in the morning or like 6:30, just depending when we're gonna start. I go in the operating room. I just set up my table, set up the mail, set up everything. They bring the patient to me, and I'm done.
Wow.
Doctor comes in, I'm already scrubbed in by that time. Then the doctor comes in, I scrub him in or her in, depending who I'm going to work with, and then we just get the job done.
Now, my question to you is the following. Would you or have you ever thought about being that doctor in any way, shape, or form? Like taking up a position like that?
Like becoming a doctor?
Yeah.
I can be a doctor, but I don't. It's too stressful.
It's too stressful.
I like what I do.
So
And
it's
I don't
okay.
like school. I
Okay.
don't like school because I do know the anatomy of like having to do the whole concept of what the surgeries are being done. Like I can probably say I can do the surgery myself,
Right.
but it's too stressful. Oh my God, they
It's a
deal
lot of
with so
pressure
much.
and-
They get sued every other day. Like,
Malpractice or
malpractice, yeah. And with Doc, I was even on his malpractice insurance because I was so close to him that I was the one always working hand to hand with him that, I was even on his malpractice insurance
Now,
just
like,
in case. Yeah.
like what exactly would if you don't mind me asking,
Mm-hmm.
what would someone or what would be the most common thing someone would sue for?
They don't like their results or their scars are ugly
Mhm.
or this came out wrong. And,
You can't control that.
You
though.
can't control that.
That's
At the end
something
of the
that
day.
your body either rejected it or it's just their body.
And not just that, and not just that, they sign consent forms where it's just like, did you forget that it says that there's only going to be a 70% improvement, not 100%.
It's not
70%
guaranteed.
is not guaranteed. You're not guaranteed to like, your scars are going to be all beautiful or this and that, or,
Yeah, because
it's
everyone's
not.
body's different.
Everyone's body is different. And not just that, let me tell you something. As humans dealing with these people, like, the patients, the clients, people, they don't take care of themselves sometimes.
Oh, no, I can see that firsthand.
We give them the instructions and to do what they have to do, and then they come back like, oh, I did this. Why? Oh, because I thought. Oh, because I read online. Like, we're literally dummy proofing everything, giving it to you in a piece of paper where it just says, hey, shower on the 3rd day, just put this ointment on, don't do nothing else, don't lift anything more than 5 pounds, don't do, why are you carrying your kid who's 20 pounds?
Hey man.
And then
Google said I could do it.
you're getting mad and coming back to us because your breasts got bigger, because now you're bleeding because you picked up your kid. You only have 3 days of surgery, so they get mad sometimes. And
Though I'll tell you this, the one thing that I have seen that's more common than anything else is, or and I don't know if you've seen it. I'm sure you have, which is those girls that go in, or guys, whatever. They go in, they get their surgeries done, they go out there, they live life like no tomorrow, and they realize, hey, you know what? I got the weight back, or this and that. Is that a very common thing? Because I see it,
Yes,
but I don't know if it's very
Yeah,
common.
no, it is. That's where how Dom said about the multiple tummy tucks. Yeah, there was a girl we had one time that she would come every other year to get lipo.
Wow.
And Doc finally told her, I'm not going to do this anymore.
You're harming yourself
Like,
at this
at this point, he's like, I'm offended. He's like, because I'm
Wow.
doing this work for you and I leave you looking so good and we have the pictures to prove it. He's like, and then you come in because you're just eating the whole world, you
Right.
know, and I can take this fat out and do it again. He's like, no, I'm not going to do this anymore.
Yeah, because then
You
it
know?
starts to get a little.
Yeah, and like you said,
Concerning.
it is bad, you know. It's not that it's bad. It's like a 50-50 on the field because, you know, sometimes people can undergo so many surgeries, just not plastic, you know, just other stuff in general, and everything's always fine. But it's like you don't want to put your body through that trauma of doing the same thing, and you know, your body scars inside too, you know, so you don't want to do that either. So
And correct me if I'm wrong, but with most doctors, reputation is everything.
mm-hmm.
So if you have, if doctors hear, oh, I have this person coming every year for the same procedure, I'm sure that doesn't look very well for them. But even though they are doing a good job, I'm sure it's like, well, why do they keep coming back for this particular thing if you already did this? So I'm sure that also had to play into factor of like, all right, dude, like, no, I'm not doing this for you no more.
Yeah, and a lot of people, what, like, you know, a lot of doctors, their patients are referrals. You know, you do a job, then someone else sees it, and then, you know, they
So it's
bring
word to mouth.
Yeah. That's where, like, you know, we've had where some sisters are the guinea pigs. You know, there's like 3 sisters on the line, and they want to get it done, but they want that first one to get it first to see how it goes.
Yeah.
And then, you know, they bring everybody. It's like a chain, you know. They keep,
It's like that family that goes to TJ and says, all right, let's see if it works on her. If it works on her, then we'll
Yes,
go.
Yeah, then we'll go. It's the same thing. It's the same thing. Definitely is.
Now, now I really want to get to the I guess the horror stories, because I know we kind of discussed a little bit but not really gone into depth.
Yeah.
Like, what is one horror story that you can literally like say, wow, like this is one that I think about whenever someone mentions that? Do you have one, or have
I
you?
don't.
No?
No, I don't.
So that would be mainly from other doctors.
Yeah, but one of the crazy things is like necrosis, like on
What is
tummy
that?
tucks,
What is
like
that?
when their skin dies. Yeah. Dom should be a surgeon. He's
How-
over here answering.
Dom knows. Believe it or not, Dom
Dom's
knows.
like, I watch botch.
No, he knows a lot.
That's
Listen,
good.
my mom, before I was born, when she was pregnant with me, actually wanted to be a coroner. So she always had medical books lying around and all this stuff. My dad got me a 42 book encyclopedia. So when I was a kid, that's what I read. When I was younger, I wanted to be a neurosurgeon. I thought I was gonna be it, but family's not rich and I'm not that smart. But beside the point.
But you know what?
He's just
It's bad.
lazy.
They're bad.
He's lazy.
Oh, trust me.
They're bad. They're crazy.
I've done my research. I know. I don't know a lot, but I know enough to where it's like, yeah, it would have been fun had I pursued it. But yeah, those guys are.
Yeah, no, they're crazy. Yeah.
They're insane.
The ones I've met, they've been married like 5 times.
So why are they crazy though? I'm confused.
Bro, you're messing around in somebody's head.
Yeah.
You gotta look at it.
You
You-
have the ability to like.
Yeah.
Done.
If I touch this one nerve, this
You're
guy's
done.
whole left side is just not gonna work anymore. You can
Yeah.
change people's personalities. You
Yeah.
can change how they taste food. You can change how
even
they.
probably take give them like an accent.
Yes, you can.
Yeah.
It's called foreign accent syndrome, and it's crazy, bro. There was this. I know we're getting off topic.
Yeah.
I would
but
really like
it's
to
all
have a
like-
Bronx accent.
Bro, there was this one lady. She lives in like Texas or whatever.
Now, is this something that you heard?
I actually saw it was a YouTube video. I saw it, and I think she was in Texas, and I guess like she hit her head or something like that. And when she woke up from she was like I don't want to say a coma. Yeah, she was in a coma for a couple weeks. She woke up and she had a British accent.
Yeah.
And
It
it's
happens.
she's like, I've never been out of the state, nothing like that. Her kids thought she was playing around and stuff like that, and all of a sudden she's hello mate, and it's like she's like, I can't stop talking like this.
Might
There's
have some tea.
yeah, and it's insane. She's just an older lady. Now she's British.
Yeah.
Well, not British, but she has
But
that
she
British
has that
accent.
accent
Yeah,
for life now.
but it's
It's
little
not-
things
at
like
that point,
that.
it's like not even worth going back in to try to fix that. Like,
Yeah,
just
I don't
stay-
even.
just stay with
I
it.
honestly don't even think
Just
they
stay with
could
it.
fix it. I don't know if they could
No,
like.
they can.
Oh, they
You just have
can.
to be really good. But
there
that's
you
just
go.
like at that point, it's just like I'm
You-
just gonna
you
keep
know
my
what's-
little British
you-
accent. I'm down for it. I would have been down.
You know what I was thinking right now, and I know again, we're getting off topic here, but I was looking at something the other day where they had this open like this guy's head was open and he was playing the violin while they were doing surgery on
Oh
his
yeah,
head.
they do that
That
to see
is-
their movements. Like
'cause
if they
fuck it
if
up-
it goes down, yeah. Once they start messing up, they go.
They
you
know,
but
okay,
if
I can't
they
do that.
continue playing, then they're good. Yeah. That's
they do it with like
insane. I
opera
have seen that
singers, or they
too.
do it with like pianists, or
Yeah.
anything that has to do like with especially like musical instruments, because
Mhm.
that's their life's work, and they're like, well, let's not fuck this up.
Yeah, I had seen that too. Yeah, it's insane.
See, that right there is interesting to me because those type of people have a lot of, I would say, balls to do that because most people can barely handle
I'd be
us.
down. I'd be
Well,
down.
let's
I'd
see
be
how
down.
big they are,
I'd be
ma'am. Let's
down.
see what you got. No, but I think the thing too is like most people can barely handle a simple procedure. You know what I mean? Like they put you under
People can't even
anesthesia.
handle
and
blood, seeing blood.
that's
like just watching it, and I'm out here like, whoa, we're cutting stomachs.
Yeah.
It's fun.
I grew up on Faces of Death, so if you know anybody out there that knows what that is, you're desensitized to it as a young kid. My brother had videotapes and all this other crap of just deaths and other stuff like that. So I mean, blood was nothing
You're
to
okay
me.
with it.
I'm okay. I'm
Yeah,
fine with it.
you're
I mean,
fine
I
with
watch medical procedures all the time. I watch when I get bored in the middle of the night, 2 a.m. I'm watching somebody get a white cut in the chest and see what's going
Yeah,
on.
see what's going on.
Autopsies and stuff.
Yeah.
They're
That's the
interesting
cool
to me.
part.
They're
Yeah, I know
interesting
they
to
are.
me. And just to see how a person died or stuff like that, and it's cool. But even reading toxicology reports, it's like, dude, really? Like this is
Mhm.
what goes through. They take your blood, read platelets, and man,
Everything.
it's so
huh?
interesting.
It's
to
crazy,
me.
huh?
I'll be honest with you. I think doing work on someone that's already passed, I think is a lot less stressful and a lot easier to go in there and do whatever you got to
Oh,
do.
yeah.
Obviously, you know what I mean. But
They're already dead.
yeah, for someone to be alive and do that, that's just so like that right there is a level of something that you really have to just be able to be okay with handling the stress and all that because that's not an easy thing to do. You know what I mean?
That being said, and you don't have to say any names. Have you ever worked on anybody that you know?
Mm.
Family, friends, anything like that?
Oh yeah.
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 So
Yeah.
with that consciousness,
And
of-
myself.
Oh,
Wait,
really?
you knew I had surgery, right, Eric? Yeah, Eric knew. But
What-
yeah, I did a breast lift.
Really?
Yeah, I was
Okay.
ready. I was like, cut me up. I was like, cut me up. Yeah. So it is scary, like how he said,
Yeah.
but it all comes like, if you're just comfortable and everything, then have no shame. Get it done.
Yeah,
You got the
man.
money for it?
Yeah.
Drop it. Drop the money. But yeah, I have had people that I've known and they come out, they've been very happy. No.
That's good.
That's it. Yeah.
Yeah, that's actually pretty sick.
Yeah.
I mean, another thing that I'll tell you that I do enjoy watching, because I know a lot of people are different. Like, you know how you said some people can't handle the blood, some people can handle certain things or whatever the case may be. The one thing that I enjoy, and I know this is completely off topic, but I actually do enjoy watching Dr. Pimple Popper.
Ooh, I love that
Dude,
girl.
I love you, dude. I didn't even know she was a girl until I realized, and then I was like, oh damn, okay, I had no idea.
She's down. I was just watching some blackhead ones before. I
Really,
got
dude,
here.
I love watching those. Those are actually pretty sick.
Those
yeah.
are good. Yeah.
Yeah, the blackhead
They're
ones are pretty
soothing,
sick.
huh?
Yeah, they're
Like,
very
just
soothing, dude. It's
coming
really
out.
interesting when they do that stuff. Like, don't get me wrong, I understand like it's gross and all that stuff, but
is
it's
it really?
but dude, it's actually pretty
It's
cool.
not gross.
It's
It's the
pre-
body.
It's the body. You're getting all the how do you say this? All the grossness and stuff out of your body.
Yeah.
That's it's not supposed to be there.
It's not. Yeah.
Yeah, I don't know. I truly do enjoy stuff like that. Like I know when before you came on, like I did watch some videos of like tummy tucks and like lipos and stuff like that, just because I really wanted to kind of get an idea of when
what
you
it
say
was.
what
Yeah.
you say, because I know a lot of people out there there might be someone out there that wants to do it, or there might be someone that is curious on it, or they have the same kind of idea as me, like they go on YouTube and they see it. Now, as far as for encouragement, like what is something that you can tell someone to just say, hey, like just do it, or would you recommend your doctor or things like that? Like,
It's just like if you've always wanted to get it done. Well, this is the thing. A lot of people think, I would say more in the male perspective, because there's a lot of jealous men when that they bring their wives, and what the boyfriends or husbands sometimes don't think. And, sometimes they're the big perception or the big reason why these girls don't get it sometimes, because they are just like, no, for what? You're
ooh,
just
that's
gonna
actually
go-
something that would be cool to discuss.
gonna go
Yeah.
looking better for someone else. As girls, like, we don't do anything for a guy unless we're like manipulated by that person and we let that person control every aspect of our lives.
Right.
But for the most part, us girls, like, we do it for ourselves. Like, we want to feel better about ourselves. We don't want to be hey,
Right.
we don't want to be big, or we don't want to have like saggy titties, or like, or
Yeah, and I want to get a ball lift.
Hey, you'd be surprised. You'd be
Can I
surprised.
get a dick extension, please?
We can't make it bigger. We can make it thicker.
What? There's a procedure for
We
that?
could do the
You
girth.
do the girth?
Yeah, the
What?
girth. Yeah.
I have a question for you. I
Yeah,
want to
the
see if,
girth.
now that.
want a tuna can. Have that.
Yeah, you have enough fat for it. We could definitely.
Oh,
do
he has
it.
enough. Yeah, he's good.
We'll
My-
fat
my-
transfer that.
my question
That's
to
why
you-
he's like, I don't want a butt.
Yeah, he wants something else. He's like, I want girth, baby. My question to you too is, now that we're on that topic, and I wanted to see if you've ever heard about it. I actually recently seen I don't know if it's a podcast or if it was just something that I seen on Instagram, but there were talking about, I guess, these porn stars. You know how they come on and do interviews and stuff like that.
Yeah.
They would say that there are some male porn star actors or whatever you want to call them. I don't know. That they get like a rod in their penis or something like
Is
that.
that to
It's
make
like,
it bigger?
is
like
it-
more stretchier?
I don't know if
never
it-
heard it.
I
But
don't know if it's
do
stretchy.
know- I have a friend. He's a surgical tech too, and his practice they did where they did like they put mesh to make it like they would buy skin like to make it bigger. So it had the ability to actually be longer.
what?
Not just the girth, like the length was gonna stretch. Yeah.
Wow. And now,
So-
does that actually work? Because I know there's been
and honestly, I can't even tell you if that actually works.
Like, has he ever told you, oh, I did this guy and he's perfect?
No, he just told me that he was gonna do that case and that they were gonna do that, but then I never
Wow.
actually asked him like, hey, like, did it work?
Yeah.
You know?
You should ask him. I want to
should
know.
ask him
Yeah,
that.
let him. Yeah, ask him about that. That's kind of
But for
curious.
sure, the girth, I have seen it.
Yeah.
We've done it.
Oh,
We've
don't,
done it.
don't. I'm telling you, she wants to play with you, dude. We got about 10 more minutes, okay? Give him 10 more minutes and he'll go and play. But that's actually pretty interesting because when I say the rod thing is because the girls were saying that there are like, they call them robotic dicks, I guess, because I guess since they do that work so much, sometimes you just get immune to it and your penis doesn't want to react because it's like, dude, again, like, you know what I mean?
So that's something different.
That's
then,
something.
yeah,
So I was
no.
curious because now that we were talking about that on the topic, I was like, oh, let me
I
ask her
can
if she's ever
probably
heard.
ask.
You can ask, yeah,
I
because
can
apparently,
ask my doctor and be like, hey, have you heard about the robotic dick?
yeah, like, yeah, because it was on. If I find it, I'll send it to you on
Yeah,
Instagram because
definitely.
they were discussing it and they were saying that like, yeah, like they can't get it up anymore because either they've done too many
Yeah, or the
pills.
pills. Yeah,
Yeah,
that's for sure. I do believe that. So I'm pretty sure there is gonna be
Yeah.
something because it's just like anything. You know, you use it so much, and
Yeah.
you know,
That's
like
kinda
having
curious, though.
carpal tunnel. It's like having carpal tunnel, you know, in your hand. Like, you just-
It's
you're
like you
just
switch
gonna
from
be
one hand to the
stiff.
other, homie. You know what I'm saying? Woo woo. That's why you got to do the left hand.
Yes.
No, but yeah, that's why. Now that we were on that topic, I was
That
like,
yeah,
oh, no,
for
that's
that
kind of curious.
that's not our line.
No?
That's not our line of work.
Ah.
But you know,
Has your doc ever described like or said? Well, that's crazy because he does the girth. How does that work? Like, how does that girth thing work?
it's just around.
Now, have you
literally
guys
your
done it in your
skin.
offices?
Not the new one.
No,
Not-
the
not
old
where
one.
with Doc. Yeah, with Dr.
Right,
Marafati. That's where I've done it all.
Uh-huh.
But no, with that we've done the girth where we just get the fat, and we're actually transferring it literally onto the sides of your penis.
So it's just the sides.
It's just because it's only the thickness, so to make it better understanding, so you can just make it
Interesting.
thicker, you know. But it's not
And I'm
gonna be
assuming
longer.
that's more pleasure. I don't know, dude. I don't know, bro. I'm not a girl, bro.
And
I
you
don't
know
know.
what's funny?
I don't fucking know.
Is that the guy came in and it wasn't even his idea; it was his girlfriend's idea.
To get a
Yeah, and he
manipulating
did
out
it, he
here.
did
And
it,
you
he
say
did
guys
it.
are manipulating women out here. This woman tried to make her life better. You see that?
Yeah.
Guys, it doesn't matter if you're 2 to 6 inches or 10 inches, bro. Respect yourself.
It
Don't
doesn't-
ever let a woman dictate whether you need that thickness, boys. You do that like by yourself, all right?
And he was down though. He was
That's
down.
crazy.
He was down.
Did you ever hear back from that person, or the doc ever say, "Oh, that guy was good," or whatever?
Yeah, well, we would see him for like the post op. So yeah, he
Mm-hmm.
was fine. He was fine after like 6 weeks. Yeah,
But he said that everything was amazing, and yeah, wow.
everything was good.
I wonder
Everything
how
was
different it would
funky.
feel. I wonder how different it would feel in your hand.
Well,
As coming from a dude, you're just like, fuck. I just put like 2 centimeters on it. Is it gonna feel different?
well, yeah, because it's thicker. It's gonna feel better for her.
That's like holding a
probably,
water
too.
bottle and a 2-liter cola. Like that's a big difference you would feel.
Or if that's the case, I would not wear fucking underwear around the house. But like, this is what you want. This is what you're getting, girl. I don't care. I don't.
You're gonna wear boxers all day.
Nah,
On
nothing.
the
I'm just
street.
gonna wear a sock. That's it.
Just imagine, like, my thing is, would a guy ever like if tell his buddies like, "Hey, I got a girth surgery,"
That's
and
what
like
I'm
that's
thinking,
you know what
too.
I mean?
I
Like
don't
that's
think
kind of
so.
like how would you go about that? Like Dom, like if you got a girth surgery, would you be like, "Hey, bro, I got a girth surgery, or would you just be like, yeah, a girth
surgery.
I don't know,
Yeah,
girth. Yeah, like a girth surgery, or what would
He's like, hey, I can't go to the gym this week because my
Fuck
dick,
that,
my
I'm
dick's in-
going
my
to
dick
the-
is in recovery.
My dick's on the bench this week, bro. I don't know what to tell you. I'd probably be like, hey, bro, we're going to the bar. And he'd be like, all right. Because I haven't gone to the bar in a while. Let's say it was recent. And just go, hey, bro, I'm packing this week. And he'd be like, the fuck, dude? What are you talking about? And I wouldn't even show him. I'd just be like, look. And he'd probably be like, don't ever show me no gay shit like that again.
That's just something like, because I know girls when they get their surgeries, like they'll be like, oh, let me show you, and then like they're comfortable with doing that. Guys, guys, like it's weird.
It's so normal for girls. For guys,
like,
it's not.
Like
no.
a guy, like
no,
his penis
any
is
guy,
his thing.
yeah.
You know?
Just in general,
cat.
like any type of surgeries, yeah. For like the guys are just not like they're just like.
It's weird.
They're not like, I mean, I have guys that in my old practice too, like they used to come and do their Botox and fillers, and I like that because it's just they're maintaining.
Okay, wait a minute. So Botox is just like getting rid of like what,
it's
wrinkles
toxins on your forehead or like the sides of your eyes.
Okay, and then what is a filler?
And then the filler is like, let's say you want to like girls when they put fillers on their lips.
So they get fillers on their lips, or what?
Yeah, you can do fillers on your lips, on your cheeks, on your jaw, on your chin, on your nose.
As you see, I'm lip deficient, so
come in,
like,
come in. We got it.
I got this thing growing, and I don't like it
because of your lips. That's why you did it, to cover your lips.
Everyone knows what she's talking about.
So I have a mustache that I never ever had. I don't like growing any facial hair, but I was bored one day, and I was like, let me just shave. And then I walk upstairs and show my friend's wife, and I'm like, check this out. And she goes, you should keep it. And then my other friend Steven heard it, and he's like, dude, keep it. So
it looks good.
The whole house was like, keep it.
Yeah.
But
so he kept it, guys.
Not for much longer. I got a championship this weekend. After that, it's gone.
There it is.
See, I figure like it would help accentuate my lips now that I have this. And I've actually had 2 girls who were like, oh my God, you look cute. I'm like, all right, thanks. Appreciate it. Whatever. Yeah. I don't want it anymore, but.
Yeah, it's gonna be gone by the end.
Yeah,
of the
it's gonna be gone by the end. Yeah, but the one thing that I'll tell you that just gonna completely throw everything off really quick. But the one thing that I do have that girls are very jealous of, bro, and I'll tell you right now, eyelashes. I got lashes that girls wish they had. For real, my things are long. You got long eyelashes? I like
my
that.
nephew has nice curly lashes too.
Oh my bad, bro. Pause, bro. I don't like it. I don't like that.
I like that.
Forgive me on that, my bad, bro.
Nah, bro, you cute too. Don't even trip.
Yeah. Well, yeah.
You got your cancer beanie on today, but.
Oh, my cancer beanie?
No,
wow.
No,
wow, bro. Leave my
he
cancer
went
beanie
there.
alone, dude.
For those of you who are still new to this podcast, please get used to my dark humor.
Yeah, that's the one thing that we're gonna go ahead and tell you right now. This podcast is gonna have a lot of dark humor sometimes because it's just how we are. We're trying to keep it as authentic as possible for everyone. But to go ahead and just end it off, Monica, I just wanted to go ahead and say thank you for coming on.
Of course.
I know there could have been more things we could have touched base on, but we just try to go ahead and go through the basics and things like that because if not, this podcast would probably be like 3 hours.
3 hours.
Yeah, because just going through everything and like that. And then is there anything that you want to go ahead and say to anyone at all whatsoever? Like, do you want to say, hey, come check me out or things like that? Or
I mean, not really.
You're just like, nah. You're like, nah,
no,
don't even pull up.
Don't pull
Please
up.
leave me
We're
alone.
good. I'm good. No, I'm just kidding. Just pretty much as being a girl, I think sometimes you're just scared of taking that next step, or sometimes people think that it's bad to like do the surgeries or stuff like that. But it's all worth it pain, I would say.
Right.
It's all worth it pain. A lot of people are just scared of the pain, but the pain is temporarily. It's going to go away.
So just recommend it to anyone that wants to.
If you want to do it. Don't feel bad because, this person said no, or this person says like you're going to look fake or you're going to do this other stuff. You just got to do what your heart says. If you want to get some titties, get some titties. You want to get an ass, get an ass. You're fat, you want to get a,
Oh, hey, Molly. She knows that the podcast is almost over.
She doesn't want it to end.
She's like, come on, man, I'm ready.
Get a flat stomach. You want to do some Botox? I do Botox. I love it.
About to get my ass done.
Get it done.
You ready?
It done.
Yeah,
Plastic
I'll
surgery
get my dick
not...
thicker.
We're about to talk about that girth off podcast, bro.
He's a little bit too excited.
He's a little too excited. He's like, yes, girth, baby. Girth, baby.
Bro, I just found out this is possible, dog. Come on now. Shit, where was this 2 years ago?
No, and that's another thing before we end too. Like back in the day when you did surgery, it's like, oh my god, you did surgery.
How could
Like
you?
how could you? You're da, 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 da. No, honey, we are in this century that we are in, and everything is out in the open. Doing your surgeries is the least of someone's freaking
Right
worries.
on.
To be honest, you want to get it done, get it done. I'm a high believer in it. Come to me, I'll definitely point you in the right direction, all that good stuff.
Okay.
So
Well,
I'm very open about it.
with that being said, I want to say thank you for coming on.
Of course.
Thank you to everyone that came in and tuned in and stayed through the whole podcast. I know you guys could have done whatever else out there, but thank you guys. Do us a favor, hit that like button, hit the subscribe button. If you want to go ahead and share it to the girl that wants to get that BBL or that lipo done. Monica is the perfect person to talk to about that. And again, Dom, do you want to say anything before we head out?
Again, thank you guys. Yes, please hit that like, subscribe button. Don't be afraid to share it. I'm sure your man wants a thicker dick anyway. Again, yeah, thanks for stopping by, guys. Monica, again, thank you for coming
Of
on
course,
and talking
thank
about
you. Sorry about
Um,
Molly, but
it. She's a part of it. Don't
she's a
worry.
part of
She
it.
answered some questions for you by barking.
Yeah.
But again, guys, thank you for joining, and we will catch you on the flip side.
And thank you guys for checking in. So catch you guys. Bye.